Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery since 1992, and I've been practicing in the Scottsdale Paradise Valley area for my whole career. All I perform is cosmetic or aesthetic plastic surgery, and one of my favorite procedures that I actually learned in South America and Colombia is the Brazilian butt lift. And what that actually is something that really was developed and became quite popular in South America, and that is making the buttock area, the rear end, more voluptuous with placement of your own fat. And what that does is it volumetrically increases the buttock size, producing lift, producing a more voluptuous shape, and overall a much nicer complement to the rest of the body, should that be what somebody chooses. That fat transfer is dependent upon getting new blood supply from the surrounding tissues, and generally it's believed that that blood supply takes about 48 hours to really start to establish itself. One of the things that people ask me is, are there any restrictions for activity? Are there any restrictions in terms of how I sit, sleep, etc. after Brazilian butt lift? And the answer to the question is yes. Generally, after Brazilian butt lift, after the fat is transferred, there is a garment that we put on that provides no pressure on the rear end. Generally, we like to have people sleep in a non-dependent way, that is, with some pillows, generally on someone's sides, without direct pressure on the buttock area. If someone is sitting, we like to have them sit on a pillow, but not for prolonged lengths of time. The reason being is that pressure in a certain area is not good for the fat and actually can cause some of that fat to become reabsorbed and actually die. So any restrictions that we have generally are about 3 to 6 weeks in length. It is not really a hardship. It's not like after having buttock implants where someone has to sit on their, lie down for approximately 6 weeks with no pressure whatsoever. I think that the fat transfer is a little bit more liberal procedure, but I think that we really need to go through with your plastic surgeon and understand what the protocol is and try to follow that pretty religiously, because we want a nice long-lasting result that looks quite natural. So the best way to find out is to go get a consultation and make this work for you. Thank you.